Antiphospholipid syndrome is a rare autoimmune disorder that affects blood clotting, leading to the formation of clots within blood vessels. This occurs both in the veins and the arteries. The condition is associated with the prevalence of antiphospholipid antibodies, which can disrupt the body's normal clotting processes. APS can cause complications during pregnancy, such as recurrent miscarriages or even stillbirths, and it may occur on its own, where it's called primary APS, or as part of another autoimmune disorder, commonly lupus, where it's referred to as secondary APS. It is a significant cause of venous thromboembolism and pregnancy complications. APS most commonly affects individuals between the ages of 20 and 50, with a higher prevalence in women, especially those of reproductive age. It's estimated that 1 in 2,000 in the UK are affected by APS. The condition is more prevalent in certain populations, with higher rates of autoimmune disease in Europe and North America. APS is primarily prominent in women, and the ratio here is around 3 women to every 1 man. Up to 40% of people with lupus may have secondary APS. The condition can affect individuals of any age, but is notably more frequent in young adults and those of childbearing age. The precise cause isn't exactly known, but it's believed to be a result of abnormal immune response. In this response, the body produces antibodies that target proteins that attach to phospholipids. These are the fatty parts of our cell membranes. These antibodies activate various components of the clotting system, including platelets and endothelial cells, the lining of our blood vessels. This leads to dysfunction in the blood vessels and promotes blood clot formation. It can also affect pregnancy by interfering with the blood flow within the placenta, leading to the complications, including things like preeclampsia and, as we've heard, even stillbirth. APS is characterized into the types of primary APS with no autoimmune condition and secondary APS, with secondary APS usually requiring a multidisciplinary approach between a rheumatologist and a hematologist. APS can lead to a range of complications, including deep venous thrombosis. These can dislodge and cause things like pulmonary embolisms. Other issues like strokes and miscarriages can occur. In rare and serious cases, APS could progress to something called catastrophic antiphospholipid syndrome. This is a life-threatening condition that causes widespread clotting and organ failure. Diagnosing APS involves clinical assessment and laboratory tests. Doctors will start by asking for any history of blood clots, venous clots or DVTs for example, or pregnancy complications. Blood tests can be used to detect antiphospholipid antibodies. These include cardiolipin antibody and beta-2 glycoprotein 1, and tests like lupus anticoagulant, which is a clotting test. You need to have 2 positive tests separated by around 12 weeks and have had evidence of blood clots to get a diagnosis of antiphospholipid syndrome. Imaging may also be used to try and assess for any blood clots that have formed. The treatment for APS focuses on preventing and managing these blood clots and, of course, addressing and preventing pregnancy complications. In addition, in secondary APS, treatment of the underlying autoimmune complaint is key. In primary APS, this treatment is usually led by a hematologist, and it involves blood thinners that could involve things like warfarin or injections of low molecular weight heparin for pregnant women. Low-dose aspirin is also commonly used. In secondary APS, also anticoagulants are used, and also drugs to suppress the immune system for conditions like lupus. These drugs could include hydroxychloroquine, corticosteroids, disease-modifying anti-rheumatic drugs, and immunosuppressants. When managing APS in pregnancy, there's usually involvement from a feto-maternal medicine specialist. These tailor-make a management plan for pregnancy-related risks to reduce the chance of miscarriage and preeclampsia. Catastrophic APS is a medical emergency. This may require admission into high dependency parts of the hospital or intensive care unit, and treatment usually involves high doses of anticoagulation, corticosteroids, a plasma exchange, and intravenous immunoglobulin. The condition usually requires intensive care support until these issues have been addressed. For individuals with APS, lifelong anticoagulation is usually necessary, and regular follow-ups are important to monitor the effectiveness of this treatment and to check for any complications. For women of childbearing age, counselling about pregnancy and pregnancy planning is essential to try and minimise any harm during pregnancy. Working closely with healthcare providers, people with APS can manage the condition effectively and lead fulfilling lives.